My program of research focuses on addressing the research to practice gap, which is really all about knowledge translation. So really addressing the issue of the lack of knowledge that key stakeholder groups fail to acquire, because when we think about academic knowledge, it's often located within the academy itself and doesn't reach the general public at large. So really thinking about ways to meaningfully involve these groups and ensure that knowledge is shared, and often using innovative methods like the arts and creative design. There's been a lot of research that focuses on knowledge translation and really highlights this 17-year gap that we often hear. And of course, that's very broad, but I think it highlights the issue that it takes such a long time often for research to end up in action or practice. Well, the impact on patients and families of a focus on knowledge translation is something that in the field we call integrated knowledge translation, which is really all about involving key stakeholders at the very beginning of a project, whether it's a research project, whether it's an intervention. And I think when we talk about integration, we're talking about meaningful involvement at the outset. So if you think about a particular project involving healthcare consumers and their families at the beginning, identifying whether this is an important issue to address in the first place, getting experiential knowledge at the top really can enhance uptake at the other end. So what we're trying to do as a platform is create an academy of experts and ambassadors who are really going to take the knowledge translation platform into all of the community academic groups and all of the stakeholders that are involved in those groups. So really trying to create an enhanced capacity for engaging in knowledge translation and really involving people in meaningful ways in that, in the entire platform. Really thinking about ways that we can be quite creative in sharing these impacts of Meridulu. So really thinking about, I guess, co-design and co-creation. So one of our platform objectives have really been to work with creatives, artists in residence that are going to be working with individual community academic groups to identify their pockets of brilliance and thinking about creative ways using performative, literary, visual ways to do that. We know from the evidence base that it actually has an impact on memory. So I think it does something in ways that the written word doesn't do. Because we are researchers, we're really interested in evaluating the impact of that. Does it make a difference? If we're sharing our knowledge in these creative ways, does it impact mental health or health literacy? Does it impact behavior, policy, for example? So we're really interested in what impact that might have at every level. I think what the art can communicate that's unique is often we think about words as being woefully inadequate to express a lived experience of an illness, of an intervention, of a service or a support, or even a social context, and how if we can use visual or performative ways of sharing these sort of intimate experiences has been shown to be much more embodied and can actually be or represent a new paradigm or paradigm shift, another way of knowing. So again, it's sort of drawing on all of our senses to communicate information. The objective of the Knowledge Translation Platform was to create champions of knowledge translation within Meridulu to share that knowledge. And again, thinking about ways that we can share knowledge that's more embodied, that's actually transformative. A lot of our work has shown the impact of the arts in terms of actually decreasing stigma of particular healthcare issues, for example, of being a way to really communicate with policymakers, with service providers, and importantly with consumers and their families in a really meaningful, engaging way. And I think we know from the research evidence that this is a really important way to share knowledge, but that knowledge is also experiential, that it's cultural, that it's pragmatic, and I think it really highlights that in really important ways.